And do you want to pray for us?
Y'all bow with me. Most gracious and heavenly Father, Lord, we thank you for this day you've given us, God. We ask that you be with those that are still affected by the tornado. Lord, lift them up, God. We ask that you be with this body as we carry out today's business, God. Lead, guide, and direct us in all that we do. In Jesus' name I pray. Amen.
Yeah.
Amen.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we'll go ahead and call Marsh County Fiscal Court to order January 4th, 2022. First on the agenda, County Clerk Tim York. Good morning.
Good morning. I'm here with my annual budget and annual deputy hire. My budgets this year expect to be $11 million, and $11 million receipts and $11 million disbursements, zero excess fees. And my deputy hire, which includes all my fringe, will be $920,000. And I would like a separate motion on both of those so the auditors can track the fact that we both were approved.
I move we approve the county clerk's budget.
Second.
For a second, all those in favor say aye.
Aye.
Any opposed? Motion carries.
Move we approve the deputy hire of county clerk.
All those in favor say aye.
Aye.
Any opposed? Motion carries.
Thank you, gentlemen.
Thank you.
Thank you. You don't want to say something on your being your last? Don't you want to say something special since it's your last time?
Well, I'll have to come in and make a statement.
Okay. We'll wait till then. Yeah, that'll be a happy day, I hope.
Next, item B, under guests, Audrey Collins with Brightview. Good morning.
Good morning. My name is Audrey Collins. I am the Western Kentucky Director of Outreach for Brightview Health, and I just wanted to thank everyone for allowing me to come today. I'm going to share with you a little bit about our new location that just opened in Benton on December 27th. I have a slideshow. I promise I'm going to be brief, by the way. It's not going to be fast, but I have a slideshow. I don't know if we're going to be able to share it. If not, I can just keep it rolling. Yeah, give me a second. Okay, cool. What I'll do is I can get started and I can keep going, and if we get it up, we get it up. If not, we're good. How about that? All right, so again, my name's Audrey. I'm the Western Kentucky Director of Outreach for Brightview Health. I have with me today Kara Groom. She's our Ops Director for the Benton location. So she oversees the daily operations of the site, and when I'm done, I'd be happy to take any questions that you all may have, and Kara can help me with those questions as well. So I always like to start by explaining a little bit about why Brightview does what it does. And so in the early 2000s, we as a nation saw a huge problem really begin to exponentially increase in our drug abuse situation. And so over the last 20 years, substance use and particularly opioid use disorder has increased exponentially. So in particular, the Center for Disease Control and Prevention estimates that opioid misuse has an economic burden in the nation of over $78.5 billion per year. So we feel that not only as a nation as a whole, but also in our local communities. In 2015, drug overdose deaths surpassed gun, car crash, HIV and AIDS-related deaths, and it continues to increase. In 2019, over 70,000 people died from a drug overdose. And so, in response to that growing epidemic, our founding leadership, Dr. Sean Ryan and Dr. Nav Kang, introduced Brightview. Brightview opened in 2015 in Cincinnati, and over the last 7 years, we have grown exponentially. As of today, we have over 50 sites located in Ohio, Virginia, Delaware, and Kentucky. The Benton location is our 13th site in Kentucky. It's the farthest west location that we have. We have a 14th site scheduled to open this month in Litchfield. So, next slide. So a little bit about what we do at Brightview. We provide comprehensive outpatient services to anyone and all chemical dependencies, anyone that's suffering from substance use disorder, all chemical dependencies, including alcohol. We are committed that our outpatient services are going to be based on clinical research and best practices, and that will change over time. So our practices will continue to change as research shows us what's the best thing to do. We are committed to serving the community and collaborating with our referral partners, which is one of the reasons why we're able to come and speak to you today, is because we know in order for us to work, we have to be willing to work with the community. So we want the community to know what it is that we do, how we do it, and really have that open dialogue so we can best serve your community. We have a treatment on demand model, and that is one of our core beliefs. If someone wants access to care, we believe that they should be able to have access to care right away. Every day that someone has to wait to receive services, their likelihood or chance of overdose or death is increased. So because of that, we have a 24/7 call access line, which means that someone can call our call line at any time, speak to a live person to have their questions answered, and schedule an appointment immediately. If it's before 3 o'clock, they can be seen that same day. They can also go online to schedule an appointment. Our referral partner can schedule that appointment for them online. And they can also walk in. So anytime before 3 o'clock at our site at 205 Ash Street, if someone wants services, they can walk in and see a medical and clinical provider that same day. Next slide. This slide is just a picture of our facility in Benton. We are very proud of the facility. I encourage you all, if you're interested, to come in and take a tour. I'd love to give you a tour of the facility. We take what our facilities looks like very seriously. They have the look and feel of a high-quality urgent care facility. We want people to feel comfortable. We want to reduce stigma, and so we want to make sure that our environment represents that. The first slide, you're going to see a picture of our exterior. The slide to the right there is a picture of one of the rooms that a case management meeting or a counseling session may go on. You'll see at the bottom left is our waiting area, and then to the right of that is one of our group rooms. So for addiction services, they're provided on a continuum. So if someone says, I'm going to get treatment, there's a variety of what that treatment could look like. That could be outpatient services, it could be intensive outpatient services, residential, or inpatient. At Brightview, we are able to provide outpatient services and intensive outpatient services, in addition to some continuing care that occurs after someone has achieved long-term recovery. And so that means that the people at Brightview will stay engaged in their community. They are going to be able to continue to work. They're going to be able to continue to take care of their needs or issues that they have while engaging in treatment. Some SAMHSA research suggests that less than 20% of people that are in need of treatment services actually need inpatient care. Now, that doesn't mean that inpatient care doesn't have a place. We're actually going to refer folks to inpatient care if they're beyond the scope of what we can do. But what it means is that that outpatient model is able to reach a broad spectrum of folks who are suffering in order to start treating them right away and also keep them engaged in the community. We know that we're going to have to work with other providers, so that's why we want to maintain those community relationships, because we're going to need to refer out for services. We can offer a lot of mental health services in-house, but for those things that are beyond our scope, we're also going to refer out so they get the help that they need. We also have a virtual or telehealth component. So for those patients when it's appropriate, they're going to have options to meet a telehealth provider if they have a transportation barrier, or because we have that walk-in commitment, if we happen to have a very, very busy day, we have those telehealth options where we can engage someone and we can make sure they're still seen. We accept Medicaid, Medicare, TRICARE, most commercial insurances, and we're not going to turn anyone away for their inability to pay. So we have payment plan options that we can set someone up if they're a private payer. So a little bit about what that outpatient model looks like inside of Brightview. There's 3 major prongs of what we offer, and that is medically assisted treatment when it's appropriate. Again, we treat all chemical dependencies, but the standard of care for opioid use disorder is medically assisted treatment. And what that means is a medication that is meant to manage their withdrawals, so instead of focusing on their physical withdrawals, they can focus on engaging in their recovery. So when it's appropriate, that is offered at Brightview. We also, all of our patients will engage in counseling and therapy services. That can include individual sessions, group sessions, family sessions, and specialized groups such as for pregnant women when it's needed. And then all of our patients have access to social support services and targeted case management. So that targeted case management is really meant to bridge the gap between what they have and what they need in order to really have a fulfilling life. So our targeted case managers identify what their risks and needs are, and they begin to break down those barriers with them. So whether that be transportation, food assistance, criminal justice issues, child support issues, they begin to work on with the patient to start problem solving that. So by the time that they're ready to enter long-term recovery, their life begins to improve and they start to engage with the community in a more positive manner. They're also going to have access to peer support services. So once we reach a certain census in the site, we will hire a peer support provider, and so that person has lived experience, and so they're able to connect with that person on a different level, and they're able to provide them support that we have found is really invaluable for someone entering long-term recovery. So everyone always asks, well, does your model work? And the thing that I love about Brightview is that we are committed to making sure that we have data to drive what we do and how we do it. So here's some recent data about the first 90 days that patients experience with Brightview. So I'm going to go over this quickly, but in the first 90 days, patients report a 70% decrease in illicit substance use. ER visits are reduced by 1/3. A 50% decrease in unemployment, a 50% decrease in alcohol consumption, a 70% decrease of time spent in jail, a 60% decrease in overall arrest, a 50% increase in engagement with their primary care provider. So what that tells us is that when they engage with us, that those pro-social activities begin to improve. So instead of using our hospital systems or overburdening our jail systems, they are beginning to contribute to the community in a more positive manner, or interact with the community in a more positive manner. And our patients report that on average they spend 3 additional days with their family or friends who support their recovery. So again, that tells us that while they stay engaged in their community, as they seek treatment, their life begins to improve. So a little bit about what Brightview can offer the community as a whole. So we offer services based on the needs of the community. So as we grow and we figure out how we can best serve you, we will look for ways to offer that. We meet the needs and ease the demand of the judicial system. We have some reporting measures in place to make sure that our justice-involved folks will have some compliance pieces with whoever it is that they're required to report to. So every 2 weeks, we will send out a report on their progress, their treatment plan, as well as their drug screens. And we also are interested and committed to collaborating and coordinating with our referral partners to make sure we have quality care. So again, we know that we're not the only place that's going to be able to serve your community. So we want to work well with all of our partners to make sure that whoever is in need of services here in Marshall County is able to get them. Again, I just want to reiterate, we have 3 easy ways to refer new patients. Again, they can call the 24/7 access line. There will be a live person there that can schedule their appointment immediately, answer those questions that they sometimes have that often will prevent someone from walking through the door. Anyone can go online and schedule an appointment. We have all of our documents online that someone can sign in advance to make sure that they're ready to engage. I encourage anyone to take a look at our website. It's fantastic. It has a ton of information on it. And then someone can walk in, again, before 3 o'clock and be seen that same day. I also want to say that we have as I said, we have over 14 we will have over 14 centers by the end of the month in Kentucky. And anyone that's in need of services can go to any Brightview location. So if you happen to be interacting with someone who maybe is in Marshall County at the moment, but really they live in Lexington, we can help facilitate that and get them services outside of Benton as well. So with all that, does anybody have any questions?
And so you work with the judicial system?
Yes.
So that, I mean, just like any other, if they can be referred to you, is that right? And then
Yes. Anyone can refer someone, whether it be the justice system, a healthcare provider, an individual, or themselves. And so if someone is justice involved, as long as we know that they're justice involved, our targeted case managers will set up an automatic reporting system. So we'll get the necessary releases signed, we'll figure out what their judicial requirements are, and then we will report out at a minimum every 2 weeks on their progress.
So I assume that those drug screens can be specific to the type of drug that you're having to prescribe for these
Yes,
folks,
yes.
right? I mean,
Well, very much
does
so,
that
because we want to monitor
show up
that
as an
those levels
opioid?
are where they should be, right?
Yeah.
So in order for an MAT medication to work well, we have to have a compliance piece that they're taking their medication as they should. And so not only are we going to look for illicit substances, but we're also going to monitor the levels of those MAT medications as well. They're going to be drug screened every time that they come into our facility.
And then obviously we're the as far west as you go, but I assume you take referrals from
Anywhere.
any of those
Yes.
counties
Yes.
located in our area. Okay, good.
Yep.
Yeah, just for your all's information, I met with Kara and somebody from Ohio, somebody up in the hierarchy before Christmas, and we had a long chat, and I'm really excited about them being here. So I expect us to be referring folks there.
Good. Well, that's great news. It's a huge issue in all of our communities, so
Yeah.
I appreciate what you do.
I always tell people I spent the last 14 years working for Kentucky drug courts, and the last couple of years I was on a regional basis, and so I oversaw the operations of the western half of Kentucky. And so when I made the switch to Brightview, one of the things that made me so excited was my experience with drug court showed me that there were major gaps, especially in small communities, and that people weren't able to get the services that they needed. And this is really a service that is needed and will help everyone move along and move forward and help people make some progress in their lives. So really glad that we're able to do that. Does anybody have any other questions?
Did you mention, is it open now?
It is. We opened on December 27th. We saw our first patient that day. We are open and ready to serve anyone who needs us. Yes.
Yep. Well, thank you. And most families, I know my family has had experience with members having addiction. If we can just save one life,
Yep.
That's a win.
Yep, because that one life can save someone else's life, and so on and so on.
That's right.
Yep, exactly.
So,
I just want to also thank the Marshall County community at large. You all have been fantastic. Your community partners are fantastic. We have been so great. We are so grateful for the reception that we've received and how many people have taken the time to listen and ask good questions. And so thank you all. I'm really impressed with everything that you all have going on. You have some great partnerships and things going on in your community.
well, good. Well, I hope it's a success for everybody involved.
Thank you.
So thank you.
If you all want a tour, let me know.
Sure. Thank you.
Appreciate it.
And we'll put this information up on our webpage so
Correct.
folks
Do
will
you
have access to it.
cards as well?
Yes.
Both, and I've got yours, but locally? No? Okay.
Next under guest, item C, Laura Matula. Good morning.
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 So, update, Laurel Matula, ER assist, consultant hired by the county to assist with FEMA public assistance and some individual assistance grant management and development management, payment and closeout. So we're getting closer. Every time I talk to you, before it was just development, now it's like development and processing. So we're getting closer. to entering the FEMA processing part of the process now. I think I'm here to give an update on the debris removal, and I'm going to defer to Roy, who has the paper in front of him. But we're about 125,000 cubic yards completed to date? 128, yes. That's about 25% of our initial estimate. And again, that initial estimate was driving down the road, windshield survey. It's hard to say at this point whether we think we're still on whether that's a solid 25% or not, because we just don't know what more is going to come to the road. But we would encourage everyone, because of our timelines and our deadlines for the reimbursement process, that we need to get everything to the right-of-way as soon as possible.
Yeah, and I just want to bring to the attention to the court, we did do an interlocal agreement. I got the signed copy from the city of Benton.
Yes.
So we do have the
Yes.
interlocal agreement
Yes,
for the
so
county
that
to.
includes getting debris to the right-of-way within the city
Yeah,
as well.
and I had Jason draft an interlocal agreement for the state, District 1, and we sent that to the state. So hopefully we'll hear something back
Right, we
from
have
Kyle.
not heard yet.
Yeah,
Those state routes, the county roads are looking better than the state routes at this.
yeah.
Think they
Yeah.
touched anything out my way.
Do we need to approve that? Do we have to?
The
It's not
interlocal
on-
agreement.
Yeah.
That-
Approve the Benton,
And the state.
Yeah.
Yeah, we can, the key is, so that people understand, is that we don't have jurisdiction
correct,
for basically when it comes to FEMA.
correct.
We just can't go pick up debris off of these right-of-ways for the city or the state, so. But yes, for both the city interlocal agreement, can we combine them or separate?
Let's do two separate.
All right, for the city interlocal agreement.
I move we approve.
Second.
All those in favor say aye.
Aye.
Any opposed? Motion carries. And then the interlocal agreement with the state.
So moved.
Second. All those in favor say aye.
Aye.
Any opposed? Motion carries.
Just one thing on the agreement with the city goes to DLG for approval, and because the State Highway Department is an agency of the state, that goes to the AG's office for approval. I didn't know if you noticed that on the,
Yeah, because they had sent a memo, and we had discussed, and a memo is not going to be sufficient for FEMA, in our opinion. So an interlocal agreement is the right way to do it.
yeah, but
Yeah,
the approval goes to two different,
yes,
okay.
yeah.
They have to be, if it's approved, it's filed, yeah.
Yeah.
Yep.
But we just want to update the court on that, and where we're at on that.
So for the FEMA public assistance, and again, public assistance sounds like it's for the general public. It's actually the reverse. Public assistance is for public infrastructure. So the public infrastructure grant process is moving along very well. We've done our request for public assistance within the grants portal. We're awaiting a grant manager to be assigned, and we'll be moving forward with our request for financial assistance. We may be one of the first counties to get all of the paperwork done, so yay us. Yay us.
Well, thank you for
That
spearheading
sounds
that.
like a yes, but in the south.
Arkansas.
Yes.
Yay.
Arkansas,
Yeah.
yeah. But that's not what you meant. Yay, us.
Yeah. But, there are other paperwork and documentation that we have to get together for reimbursement as well, and that includes all the police, 911, emergency management, road department during the event, and then also any damages to, I'm working with the road department for any street sign or stop signs that have been damaged. We did put the call out in the last fiscal court meeting for anyone that saw damage to public infrastructure to go ahead and call it into the hotline as well. And we haven't seen a whole bunch of that happen, so I just encourage everyone, if there's public infrastructure, street signs, stop signs, if there's ditches that are scarred and maimed from debris that would need to be reditched, that's everything that is public infrastructure, so it's county maintained, county property, that is reimbursable for a grant from FEMA. However, we have strict timeliness deadlines, so if we don't identify it, we can't ask for it.
So I assume we've identified Cambridge Shores Road, Drive, whatever already. I mean, there's a,
Yeah, we'll
Obviously.
have to reditch, there's,
well, and
I don't want
it's
to
just-
promise all new roads because that becomes a very tricky subject within the FEMA grants system.
Okay.
And so it's, if I'm able to develop the documentation that can clearly document that it's from debris
Before and
trucks or
after.
emergency protective measures, yes, exactly, before and after. But FEMA does not want to be in the business of re-asphalting an entire community, so.
But does okay, I may
Yeah.
have missed what you just said, what about the debris removal trucks and the weight
Yeah.
of those
So-
trucks, is that?
Yes, so if it's incidental to debris removal, then yes, and if we have before and after pictures, that's something that we can claim from FEMA.
Okay,
They don't love those grants, so we'll have to do some extra documentation. And again, it's a joke, but it's kind of not a joke. We get paid by the pound of documentation, so the more documentation we have, the better the likelihood of that grant being processed
So-
quickly and fully.
what about, I think the governor asked for an extension, which I
Uh-huh.
assume every governor does in these cases, I don't know,
Yeah.
So have you ever seen an extension granted?
Yes, it has to
Okay.
do with meeting a certain threshold of damage. So that's why it was very important for us to report our preliminary damage assessment numbers and to start entering all of our documentation into the FEMA grants portal system. So they can't award that until all of us, all the counties, start reporting. We can't say, it smells like it should be 90%. We have to have the documentation. So it's very likely that that request will go in, but it may not be approved until we
After the fact.
each and all of us get some documentation into the
As
system.
far as where we are at the end of that 30 days, is that a key? Or you're saying the initial estimates of
Right,
debris?
Right.
Okay.
And I don't want to give you an exact number what it has to be because
Yeah.
I'm probably wrong, but it's a pretty significant statewide threshold, and so Marshall County can't get there
On its
by
own, right?
correct.
Yeah, okay.
And they may be using, U.S. Army Corps of Engineers has been estimating some debris, so it could be that's what's being used, but I'm not involved in those conversations. so
I mean,
can't-
surely if they know that that's a piece, the biggest
Correct.
piece
That-
of the
that is biggest
extension,
piece.
they will
Yeah. Yes,
get on it.
yes. Fingers crossed.
Because it is the 4th, right? So
Well,
6
so
days.
They don't have to make that decision by the 9th.
Yeah.
They can do it in April and that has happened. Like, we get all the projects and we parse them out by dates of service, and then 6 months later, they say, hey, redo all those grants and projects, and you have to parse them out to other dates of service because of different federal shares.
Yeah.
So
And
it may not happen before, but that doesn't mean it won't happen after.
Yeah, and it's, in my opinion, it's best to prepare for
Correct.
Yeah.
the 11th.
Yeah, I agree.
Yeah, and then if we do get an extension, then we
Right.
get an extension.
Correct. There's also a possibility, that the cost share will go down, or the federal share will go up. So there are other things that may happen that will help Marshall County significantly financially. But they may not happen. Would you like any other gems?
Thank you. Yeah.
Okay.
We're doing our best to make it happen.
We are in a good position.
Correct.
Yes.
At this point.
Gotcha. Okay.
Everybody here understands who you're dealing with.
Okay.
Yeah.
Yeah.
Did we find out within your, I guess, I keep asking questions before we get to his report, but the number of trucks yesterday, we had a question of
Was it
if it added us.
15?
No, I'm saying like 40 trucks. Did that add, you had asked if that included our 18 or whatever.
I'm going to defer to the contractor who I
Oh,
see.
okay.
Do you know how many contractor trucks were on the road yesterday?
I think there was 24
Okay.
contractor trucks, which would be 48 boxes, plus, I don't know exactly how
Oh.
many Roy had.
So that.
Okay, so maybe that 45
Includes-
number is the boxes, not the trucks.
Well, that number means the number that, on our daily report, we have a total number of trucks, and I think that includes all the trucks that have been sorted.
Boxes.
Okay.
The report that you're getting includes, like it says, like I'll get, did somebody have a copy of what it said yesterday?
It says 45.
45 trucks. So what that meant was that there were 45 boxes. So just to give you
Okay.
an example of that, Roy probably had 6 or 8. What'd you have yesterday?
7 trucks.
7 trucks. So there was 37 then of our boxes working. And my guess is, without looking at it, because I haven't seen the report yet, my guess is that there was, say, 15 of those, or 14 were double trucks.
Yeah.
Sometimes, and then 8 of them were trucks that were working in narrow areas where they could only have singles. So that can change from day to day. Depending on the area we're in, we may have half of our trucks, what we say, drop our trailers, because it's too tight, or we can't get around. So the number of boxes might change every day, but we basically have 25 or 26 trucks and their trailers measured in. But they won't work every day based on the limitations. The trailers won't work every day. And occasionally we might have a truck broke down, or there could be a repair or something like that, but that's the general gist of it.
Okay.
And truthfully, you know, we're happy to add more, but I think, as you guys know, we've talked about a lot of the debris is in really central areas, and so that's where we're at on that.
Do we want to, well, I tell you what, won't you just stay there for a second? And we'll go ahead and jump to old business. Approve the minutes for December 16th, emergency meeting, and December 21st meeting.
So move.
Second.
All those in favor say aye. Aye. Any opposed? Motion carries. Lakeland Wesley Village Day Use Park. We had discussed this. We just never approved with TVA to do the license for this specific park. We did the other ones, but we didn't do the Lakeland Wesley Village Day Use
Okay.
Park.
I move we approve the
Second.
TVA license.
All those in favor say aye.
Aye.
Any opposed? Motion carries. Under new business.
Can I ask
Go
a
ahead.
question, since it's old business do we have an update on the AG, the contractor reporting?
Yeah,
You sound like you have a
Yeah.
answer on that. You know, we talked about whether the AG member in our
Yeah.
last meeting.
Yeah, so we basically took the 2009 declaration, not declaration, but the executive order.
Yeah, it's a
And-
form. It's an AG form. That form
Okay.
that you've got is an AG form.
That's an
Yeah.
AG form. Okay.
So the contractors have been sending those forms to my office. And then there's a website, or they can go on the website, the AG's office, to register as well.
Okay.
So we'll push that out. So we talked yesterday briefly. We've had really 2 that we're aware of, contractors that either price gouging. So we're going to try to warn the citizens, you know, there are companies out there, or there are people out there that are either going to try to price gouge them or give them some false goods. So I think it's going to work, but
Okay.
we'll find out.
All right.
New business, sheriff's annual order setting maximums for deputies and assistants. Somebody got any questions on this?
Approved.
Second.
All those in favor say aye.
Aye.
Any opposed? Motion carries. Okay, now we'll get to item B, under new business, debris removal. We met yesterday. We reviewed, we had 5. I don't want to steal your thunder, but if you want to go in on, we did have some that did not make it. I guess FedEx didn't deliver, but we did have 5 bids come in for debris removal. And we had score sheets that each of us went through and scored each bid that came in. And
Yes.
I haven't seen the totals, so.
So in those, there were multi-layers of scoring. The final result is that the current contractor, LGS Looks Great Services, it was the highest scoring proposer. The second was a company called Series, and the third was TFR.
I'll say that they were very competitive. Here they are right here.
Right. They were
But
all very good companies that responded.
one thing I did notice that there are a lot of tornadoes. A lot of emergencies that we don't hear about.
Amazing.
Correct.
It's,
Yeah.
And I move we approve it.
LGS.
Yes,
Great
looks
services.
great services.
Second.
There's second. All those in favor say aye.
Aye.
Any opposed? Motion carries. We also met and discussed the bids for line of credit. We had 2. CFSB and Kentucky Bank were the 2 that bid.
Yeah, it was First Kentucky and.
First
and,
Kentucky.
FNB, but with a participation with First Kentucky.
Yeah. I think the consensus was CFSB is who would offer what we're looking for. And just so that folks understand, we did this, we went above and beyond to do this process so that it's more transparent. But in the end, what we're looking for, I feel that CFSB can meet that. We still have to negotiate some items, but my recommendation would be CFSB.
So moved, Judge.
Is there a
Second.
Second. All those in favor say aye.
Aye.
Any opposed? Motion carries. And this is a resolution. I'm just going to read it. A resolution authorizing the Morris County Fiscal Court to request and open a line of credit for purposes of facilitating debris cleanup related to the tornado of December 10th, 2021. Whereas on December 10th, 2021, a devastating tornado swept through Morris County, Kentucky, leaving behind a trail of destruction to numerous properties. Whereas there exists an immediate need to remove this debris from affected properties. Whereas the Morris County Fiscal Court is in need of opening a line of credit to pay for debris removal services, where immediately thereafter, the Morris County Fiscal Court will seek reimbursement from FEMA. Now therefore, be it resolved by the Morris County Fiscal Court that 1, a credit line not to exceed $15 million is needed to facilitate payments for debris removal services related to the tornado of December 10th, 2021. 2, the line of credit will be used as a funding source for those payments with reimbursements for said payments to be sought immediately from FEMA. 3, the Morris County Fiscal Court will act as a fiduciary agent of these funds to be used for purposes intended for this project. 4, the Morris County Judge Executive is authorized to execute any and all necessary documents to carry out the purpose of this resolution. Resolved this 4th day of January 2022. Is there a motion to approve this resolution?
So moved.
Is there a second?
Second.
All those in favor say aye.
Aye.
Aye. Any opposed? Motion carries. let's see, I'm trying to think if there's anything else as we move forward.
Not unless you wanted to hear from Compass 82.
Yeah, I would, because I know I spoke with FEMA. I think it was the day before New Year's. It might have been that Thursday. They had at that time, out of the Joe Creason building, they had about 800, a little over 800, for lack of better terms, applicants or applications. I know we've been pushing out based off of your recommendation to tell folks to just apply. And if they get denied, they get denied. But if they don't apply, they will never know if they do get any benefits. So we've been pushing that out. But we talked about the long-term housing for Marshall County. Those numbers, from what we could tell, as far as in our state parks, off the top of my head, we had just a few that were dislocated in some of our resorts. But majority of the folks in our county are from out of county, from other counties that have come to our state parks. But Sue, do you have anything else to add as far as what you're seeing and what you're getting?
Happy New Year to you all.
Yes.
Happy New Year.
So you're 3 weeks down, entering into your 4th week after impact. So while Laurel and your team is handling the public assistance side, we have been doing a dual track and working with the emergency management and the public information officer and the parks and recreation, all who have just done a phenomenal job. But you just bring up a good point, Judge. According to FEMA, you have 800 people from your county that have registered for FEMA. In our universe, then we're calling everybody that calls into this hotline, we only have a fraction of that. So we are entering our 4th week, and we really need for people to call into that hotline so that we can get a true assessment of what the needs are in the community. Because it is very hard to plan strategy moving forward. And the first thing up on that menu is going to be the temporary housing if you don't have a clear indication of exactly what the situation is. I've talked to many residents myself, some who are staying out of state. So they're not in any of our displaced numbers. They were lucky, and I believe that there's probably a batch more of these people who the impact came. They had a family member, maybe in a different state, a different county, and they just went there, especially through these holidays, right? You have 2 holiday weeks. But in order for us to really plan and strategize for this long-term recovery, we need some true numbers. So I think if we can all work together in many different mediums, there was the press conference right before the holiday break, asking you guys to send it out to anybody that you know. I think we need to really work with the Red Cross and with FEMA, because those are 2 of the entities that touched these people in the beginning. Unfortunately, there's not a quick transfer of all of the names of the people so that we could do our own follow-up. So the best and fastest way is really to funnel everybody into this hotline number so that we can do a screening and triage. You have FEMA, whose max grant is $37,900. Right now, there's a lot of, I think there was only 1 person awarded that as of last week. And you don't have to look far to see how much damage, and it seems like there should be a lot more. But insurance is going to have to come in first. So you have to wait out that time frame for their insurance to come through to see if there's anything above what insurance gave them that they could qualify for FEMA. SBA, just to clarify, it goes up to $200,000 for repair and replace for people's structure, and this is for their own homes, and up to $40,000 for personal property. That interest rate is under 2%, and as I am talking to your residents, I'm just clearly explaining to them that at this point, if they know between their insurance payout and their own savings that they have the ability to put in a construction budget to rebuild their home or repair their home, then okay, I understand. But if you think for one chance that you may come up short on that budget, please make sure to have the SBA application in so that you can fill in those gaps so you can move forward with the project. Insurance, we are working to educate the residents on how to document what was inside their home, because many people, of course, had their debris spread miles. So it's literally going back and looking at photos to actually show what you lost. So it's a tedious step. We're trying to help residents just be organized and have an understanding. And then we are really looking forward to the information about the contractor list, because again, if we can get it out through the media, get it out through the hotline, get it out while we're doing the screenings to make sure they all can get plugged in so they don't get scammed by a contractor. And then lastly, we're also talking about the longer term, what it looks like. And I'm working closely with the OEM and with the Parks and Recreation to look at what are some possibilities that we could get some of these national VOAD building organizations to house in Marshall County to help our residents. And I had talked to somebody yesterday who is very interested in having this service because they did not have insurance on their home. They do not have enough money on their own to build it back. They are working and looking through towards SBA, but they still may need to have these nonprofit groups come in to help offset some of the labor costs to get back home. So we have a conversation starting this afternoon, and we're hoping that we can get some more interest from these national VOAD partners. They're right in the beginning of trying to think of where they're going to set up. So we'll keep you guys in the loop, and if there's any way that we can be an encouraging county for them to set up shop, that would be really helpful for the residents.
So I feel like, I know I was out maybe Friday at Cambridge Shores, and it was interesting to talk to the folks who had been impacted that did not know, had not called the hotline yet. And I was getting that out to people, and they were calling. I mean, I feel like a few of them called while we were there that day. I think it's difficult because I think sometimes we think everybody is watching social media, and they're not. And I mean, some of these folks I would have thought would have, and they said, we don't have internet. I mean, we do not have our internet back yet. So, I know that particular day, Sue, they fed 1,000 meals right there at the Cambridge Shores building. I mean, just setting up there one day for that, I think we might have a huge success of folks that have no idea about that hotline. I mean, I feel like, because we've been so focused on it, that everybody knows about it, but I just being out there that day said, no, I don't know that they do.
Well, and some of those folks through the HOA, they're not from here. So they're trying to find a resource to get that information. So through the HOA, we were able to get that information out. And as soon as it was given out through the HOA, for folks that have a secondary home, that's when the hotlines did start calling. But there's going to be a percentage of folks that, we can't get a hold of, just like what you had said. We don't have a number of folks that aren't even here.
Yeah.
That they've gone to live with family somewhere else, and
But I think I don't know what your word was, but it was an insignificant maybe amount of those 800 have called. I mean,
fraction.
10%, a fraction.
Yeah.
10%.
Probably under 200 that we have.
Yeah, okay, so
names and
under
address.
25% of.
Yeah, so, and you're right, Monty Lake, you definitely need, after any disaster event, you need to have multiple pathways to try to touch people. So the Facebook Lives and the social media, that is certainly one way. Putting it in a newspaper, that's certainly another. On video today, that is another. We also talked about the possibility after the holidays, starting to set up maybe some type of public meetings. Of course, we have COVID, so we're going to just figure out however people feel comfortable. So maybe it's a virtual, but that idea of trying to find some different ways. And also FEMA started last week to go door to door, and we actually tracked them down and gave them the flyers and said, listen, if you're going door to door, please make sure to promote this.
That's good.
And the same thing inside FEMA, right? FEMA has their operations center. They're the ones that has the 800 names and the 800 contact information.
Yeah.
But it is a very challenging
to get that
time
information.
to get that information.
Yes.
So we already offered, if you can't give us the names because you're concerned about privacy, then can you promote our line? As this is the county line. So if you're talking to Marshall County people, let them know that this is their first resource that they should be tapping into.
Yeah.
So if we can get them to participate in that concept of giving out that number, that would go a long way. It would also make the hotline go crazy, but it will go a long way to just capture these people. So I think that's going to be the name of the game this week, is to try to really get out there and get these people into our system so we can screen them and bucket them and know how many people are impacted in each of these families, how many are seniors, what's their income, like to try to really dive in deep. And then you guys can have the fuel to figure out what the strategy is going forward. And then the second thing this week is to really continue to work on reaching out to these national building partners and trying to gauge their interest and willingness to set up camp in Marshall County.
Yeah, because that's key. They are huge as an asset during a crisis like this, without being able to identify those who have that need and getting the VOADs and the citizens together, because there will be a time where the VOADs are going to say, well, there's no demand, and they're going to go to the next disaster.
Yeah, in Kentucky, you don't have to go too far for that next disaster, unfortunately.
Yeah.
So,
Well, I hope that folks will look at that not as, this is not a way for us to keep up with you. I think unfortunately it might have been put on there as keep up with you or something like that. But it's not government keeping up with you.
Yeah.
It's not a negative. This is a positive. We have to, if you've gone to FEMA, there's absolutely no reason why, if you've given your or talked to a federal government body, there's no reason why you wouldn't want to call, to me, a county government body, because it always comes down to, we're always going to be the one to help or have to step in, whatever it is, whenever the federal government and state government won't.
and you
That's
guys
what
are
we're
only going
here
to be able
for,
to argue for additional resources based
If we
on
know
the
that.
data.
Yes,
So we're a little shy on getting
yeah.
to the next layer
That's a
of
good
that
point.
data. So that's really what
true.
we have to focus on in these next few weeks is trying to collect that.
The long-term planning is key. Kind of like what you were saying, if you don't get the information that's needed to prepare for that long-term planning, it's going to make it more difficult on everybody.
Yeah.
Thank you, Sue.
You had mentioned the hotline number. Would you want to give that out before you leave?
Sure. 270-527-8657. So again, 270-527-8657
Sue,
Thank you.
have you been on coffee call yet?
on Coffee Call.
Okay, obviously, if you say that, you mean no. Maybe you need to be
WCBL,
on.
our local radio station. A lot of folks listen to
Justin
that.
and I need to take you to coffee call. That's what needs to happen, and boom.
I'm taking direction from Brittany. I learned that.
Okay.
Whatever she
Y'all
tells
should
me
be
to
on
do,
coffee
I
call
do.
too. Kara, have y'all been on coffee call? You have? Okay.
Okay,
All right.
good.
All right, well, we'll look into it then. All right.
Thank you.
Thanks, Sue. Item D under new business, transfers.
I have two things, an appropriation transfer moving $33,595 from the general fund investments to the capital projects line for the Draftonville sewer.
Move we approve.
Second.
Second.
All those in favor say aye. Aye. Any opposed? Motion carries.
And then I need permission to move that money from the general fund savings to the general fund checking.
So moved. Second.
All those in favor say aye.
Aye.
Any opposed? Motion carries.
Is that all you got?
That's it.
Nice to have you back up here. It's been a while.
Different chair.
Different chair, but nice to see you here.
Don't have any overall economic update for us.
Yeah,
Yeah.
do you care to give us a complete
She
update
does
on
not.
where we are?
State of the county.
We'll have
We can
questions
find some
next time.
questions.
We can find some questions. Bills and claims, item E, is there any reason to deny payment of the bills and claims? Hearing none, let the clerk record that the bills and claims would be paid.
So moved.
All those in favor say aye. Aye. Any opposed? Motion carries.